bangifonela bangitshela ukuthi umzulu wami akasekho azamile ngathi vele ayikho into enizamile because mntanami umzukulu wami naku kudala efikile esibhedlela kuthiwa i-emergency uyakhathala it's fine umntwana uzamile wazilwela ecabanga ukuthi uzoba right until waze wabona ukuthi ayikho into engiyenzayo la ngcono ngisihambele.
It's been a tough week for this Vosloorus family. After the excitement of expecting a child and making plans for that child's arrival, they encountered heartbreak instead. After experiencing pain, the child's mother was rushed to hospital from a clinic at around 2 a.m. on the morning of the 17th of August. But after arriving at this hospital at around 3 a.m., she was only taken to theatre to give birth at around 8 p.m. that night, 17 hours after being admitted on an urgent basis. By then, her little girl was in distress and did not survive. Although the Gauteng Health Department insists 2 babies died as a result of the bacterial infection, mothers who've lost their children between July and August this year say there are no proper services here and hygiene is not the only problem. Nurses say they are understaffed and overworked, adding that they have pleaded for help, but their calls fall on deaf ears.
If you are nursing 96 kids, 96 neonates, you are only 5 professional nurses who are supposed to give that medication. The first patient, you are giving the first one. Like after how many minutes or hours will you be giving the 20th patient? What about the 50th patient? That's where the resistance happens, because there is breakdown in the flow of giving that medication because of shortage of staff. Those units were not supposed to die. If the department was listening to nurses, if the management was listening to nurses, this could have been avoided.
Community members say they are growing increasingly frustrated. They say the hospital is simply too small to cater for the area's large population. Hospital management is adamant that everything is under control. The National Institute for Communicable Diseases has now been called in.
We are in the process of scrapping down the unit, and we have also quarantined the unit to make sure that we limit the exit of the babies and entrance of any other babies within the unit.
Problems seem to persist inside the walls of this hospital behind me, with nurses saying patients are dying unnecessarily, blaming mismanagement and a lack of care from those in executive positions. Masego Ratlaga, Vosloorus.